Sleep Better Indy is a separate company from my family dental practice. And what I am trying to do with that is identify and help people who are having trouble sleeping. And there's a lot of us out there. And I'm also helping to try to help people who snore. And that's the main reason why I started Sleep Better Indy, because I'm a snorer myself. And I sought treatment, and I've been taking care of that for the last 6 years. So that's one of the reasons, the main reason why I started into this, and I enjoy it because the people I've treated, it's made a difference in their lives. So that's very rewarding. So, as I mentioned, I'm a snorer, and it didn't get this bad, but close. Neither one of us were sleeping outside, but there was a split in the sleeping quality of my wife and I, and so it was keeping her awake, and I know a lot of us have heard that. So I said, okay, I'm going to do something about it, and that's why I'm currently working on my diplomate from the American Academy of Dental Sleep Medicine. So I'm getting it's basically a master's in sleep. So snoring is what I do, and when we think of snoring, what exactly is snoring? How does it happen? When we fall asleep, our muscles relax, and our lower jaw tends to fall back. And what it does is it narrows our airway. It doesn't block it, but it narrows it. And that narrowing increases the airflow through our airway. And that's what causes the reverberation in our soft tissue in the back of our throat here. And that causes the noise. And everybody has it to people who snore, of course the severity varies from person to person. But that is how snoring happens. Dealing with snoring, Marge is a sufferer of Homer's antics here, but Marge is trying to find a way to make it through the night, and Sleep Better Indy can help Homer get through help Marge actually get through the night a little bit better. So that's why we're here. Obstructive sleep apnea. What obstructive sleep apnea is snoring taken to the next level. Snoring is the partial blockage of the airway. Obstructive sleep apnea is when all the tissues collapse and completely block the airway, so the breathing stops. This demonstrates the airflow, and this is the tongue. Everything's falling back. Your pharynx, the pharyngeal walls, the back of your throat, everything just kind of closes together, and people stop breathing, and it can be up to a minute, and it's just dangerous. Blocking the oxygen from our tissues causes damage. The brain is trying to tell the body to breathe. The heart is struggling for oxygen. It creates issues as the body struggles with oxygen, lack of oxygen. It's a constant struggle, and it creates tension in our blood vessels, and it causes the body to react in ways that causes damage to organs, heart, blood vessels, brain.
Are people unaware of this? Or how does, obviously if you quit breathing, somebody becomes aware of it.
Mm-hmm.
But how does that reveal to a person?
The most common symptoms are you catch yourself waking up and gasping for air, trying to catch your breath. There's interrupted sleep. The feeling of being unrefreshed when you wake up in the morning is another common symptom. Brain fog, getting a little more forgetful, things like that. When we sleep, our body or our brain goes through it, most of it as a detoxification process. So a good night's sleep helps basically the brain clear itself, and that gives you that, hey, I'm refreshed, I'm ready to go, I'm mentally sharp. When you get that fuzzy, cloudy feeling is when it's a good sign that you didn't sleep well, you interrupted sleep. So with obstructive sleep apnea, you're constantly waking up, because when you stop breathing, your brain is sending a signal, hey, we need oxygen here, wake up. So you start what we call an arousal. So you may just kind of wake and turn over to your side, or just reposition yourself in the bed. So those constant awake and sleep patterns creates fatigue and just a general feeling of malaise. You just don't feel good. You just don't feel energetic. And your bed partner is typically, we hear that from patients. Hey, my wife tells me, or my husband, it goes both ways. Notice I stopped breathing. So this is kind of like a demonstration of obstructive sleep apnea. It's showing. Let me back up here. So we have the tongue here. It may be hard to see with the sun brightening, but this is the tongue and the lower jaw. This is the airway. And as we sleep, let me back up one, come back to it. The tongue falls back. It just demonstrates the complete blockage of the airflow. So it's just a demonstration there. So what do we do about obstructive sleep apnea? Once you've been diagnosed, what are the treatment options? So we have, there are different, one option is just go to the other room, but that's not one I would recommend. That's kind of burying the head in the sand kind of thing. I don't recommend ignoring the signs and symptoms. Some people try herbal remedies. That's a lot of people like to try that as, a lot of people like the herbal side of things. So that's something you can try. Consultation with an ENT is another option. ENTs can look to see maybe you still have your tonsils and they're restricting the airway. They may look at different ways of just creating more space back there so air can flow.
What's the theory on the herbs of the function of how they function?
Most of them deal with most of them are natural anti-inflammatories. So what they hope to gain there is as the airway, the inflammation of the airway creates swelling due to the sleep apnea. The constant pressure on the airway irritates the tissues and cause them to be inflamed and swell. That will further constrict the airway. So the herbs, they're mainly natural anti-inflammatories, and just the theory is if the tissue isn't inflamed, it's not swollen, the airway's going to be larger, less likely to snore, less likely to collapse the airway.
Thank you.
Why doesn't everybody experience this?
Anatomy. Some people's muscle tone stays rigid enough that the airway doesn't collapse. Some people's airways are just large enough that enough air gets through. Such as myself, I tested negative for sleep apnea, but I'm a snorer. So my airway constricts, but it doesn't close. So I get the reverberation of the tissue, but I don't get the complete blockage of the tissue. And there's genetic predispositions. That just some people are just built differently. Tongue's bigger, the mouth's smaller, airway smaller, the neck is thicker. There's just everything can kind of accumulate to create a perfect storm. But the ENTs can look and see. That's some people require an ENT referral. Most of you probably heard of Cpap. A lot of times, this is the first line of treatment. It's effective, it works. The efficacy is like 95%. So a sleep medicine physician puts you on a Cpap. If you can wear it, you're not going to have sleep apnea. But it's almost as close to a guarantee as we can get. BiPAP's Cpap's cousin is just a little variation of the Cpap. It just alters the pressures a little bit. But the Cpap, you see the machine, it just forces air down your throat to keep the airway open. Airway can't collapse if it's being pressurized. And that's what a Cpap does. It's just forcing air down through your airway and keeping the tissues open. And it's very effective. It's just, can be problematic for people to wear. It's just the pressure and the mask and therein lies the problem.
Keep it clean.
So and I had a physician tell me it's similar. Cpap, wearing a Cpap is similar to basically driving down the road and sticking your head out the window. for those of you who aren't familiar with it, that's basically what it's like. It's forced air, so it takes a little getting used to.
Does it just wearing that darn thing
Yes.
keep you awake?
Yes.
It can, and that's one of the problems. Yeah, that's one of the problems. You know, you have the mask on. It's got a hose connected to the mask. So you've got the hose connected to the machine on the nightstand.
And you gotta clean it every day.
You gotta keep it sterile. You gotta keep it clean, as you mentioned, because and that's when machine has moving parts. And Philips company, Philips Electronics, they're a major manufacturer of Cpaps. They had the recall due to internal components breaking down and flying through the tubing and into the mask, and people were breathing them. Yeah, so it's
Particles?
yes, it's So
Sounds like lawsuit stuff.
right. And that's created a supply and demand thing too, because they've had to recall, and they're a big player in the Cpap game. Second option, and this is more my wheelhouse, is the oral appliance. And so I wear an appliance similar to this and have for the 6 years that I mentioned. And how this works is it's like an upper, it's a heavy duty retainer and lower retainer, and they're connected. Different styles do it different ways, but it's an upper and lower that's connected, and what it does is we use the upper jaw as anchorage, and the appliance keeps the lower jaw forward. So when you fall asleep, your lower jaw can't collapse because it's being held forward by the upper and lower that are connected. So we use the upper arch as stability. It's portable, no hose, no noise, no air pressure, that kind of thing. So comparing the two main modalities for treatment, the Cpap, we have the hose, blow in the air, down through the airway, pressurized air, keeps the airway open. It works. It's just the problem is, after 6 months, only 40% of the people wear it. They start out, they try it, they kind of like it, they realize it's important to wear it, it's great for the health, but they just can't stand the pressure, they can't stand the mask, can't stand the hose, gets tangled up, maintenance, cleaning, it's cumbersome. A lot of people don't like the idea of the mask, and I've had a lot of people say it makes them claustrophobic. It can be a problem. Sometimes they use just, instead of a full face mask, they'll just be what they call pillows that go in the nose, and some people's anatomy just doesn't accommodate that. So there's obstacles to overcome, but if you can overcome those, it's very effective. With the mandibular appliance, it's just more comfortable. It's non-invasive and 90% compliance. If I'll not wear mine on purpose every so often, just to, I record how my snoring. There's an app on the phone that I use, so I can, just to see where I stand. Yeah, they have an app for everything. So I compare my numbers without my appliance and with my appliance, and it's dramatic. I get my score is over 100 on the app without the appliance, and with the appliance, it's in the single digits. It's like 5 or 6. So huge difference in bringing my lower jaw forward and keeping it forward while I'm sleeping.
Do people get so used to it they just don't even realize it's there? I mean, I've worn a mouth guard for 20, 15 years for grinding or
exactly,
and I put it in and forget it right away. I just don't even know it's there.
and it's the same way with my appliance. And I really don't forget it, but in the off chance, once in a blue moon that I do, I almost feel like naked without it. You know, it's like, hey, something's wrong, and then because it's so effective, you know, it just makes a big difference. So when you compare the two, the overall effectiveness of the appliance is higher than the Cpap because we have to take into account the compliance is so low with the Cpap and it's so high with the oral appliance. The efficacy of the oral appliance it says 75 here. I've read studies where it's closer to 80 now. So I think the overall effectiveness of the appliance is probably closer to 70 versus the 38 versus the Cpap. So I just like to leave you with, you know, life's hard enough, right? daily things, not waking up refreshed and mentally alert just makes it even harder. So I would just like to recommend anybody who thinks they have a problem, you know, seek help. You know, we can point you in the right direction if you want to get a hold of us. We work with physicians that treat this, sleep tests, that kind of thing. That needs to happen so proper diagnosis can be made, and then we get you into the right treatment.
I had a couple of questions. This first one was, is there any insurance coverage for this type of device?
Yes, insurance covers it. It's subject, like anything else, it's subject to your deductible.
Okay.
So as a dentist making oral appliances, the oral appliance is considered a medical device. So my Sleep Better Indy is actually a durable medical equipment company.
So health insurance instead of dental insurance?
Correct.
Okay, that's good.
Correct.
If you're lucky enough to have Medicare, it pays for it.
Well, good for you.
It's a lifelong quest.
Yeah. Second question, does the use of a device like this ever cause TMJ problems for people?
It's rare. I can't say it never happens, but it's rare. The incidents are low. What we find is we're very adaptive to this appliance.
Right.
So the oral appliance that I wear, it's adjustable. So how we treat patients is we start them in a certain position. We bring your lower jaw forward just a little bit, just to get you used to the appliance, because you're not used to having that in your mouth. So, and then we monitor how you feel. We utilize the Snore Lab, the app I mentioned earlier, and that gives us some diagnostic feedback. And then we titrate it or advance the appliance, advance your lower jaw a little bit at a time until we get numbers on the app start coming down. You're starting to feel better. things like that. So we use those measures to see where we're at and make sure we're heading in the right direction. When I wake up in the morning, I've worn mine for 6 years, and I just kind of move my jaw around a little bit, and it starts falling back into place. By the time I eat breakfast, I'm good. I'm on my way to the office. One of the things I wanted to share too is the little things that the appliance can help with. I have a real world story I have a patient who's a physician. He's been working with his GI doctor for years because he's had reflux.
Yes.
And they hadn't tried medicines, he's tried positional therapy, or raised in the bed, wedge pillows that kind of raise you up, different medications. He snores a little bit and decided to seek treatment. Made an appliance, and in 2 weeks, his reflux was gone. The snoring creates negative thoracic pressure, pulls the gastric juices up your esophagus. When you open the airway, you eliminate that pull on the gastric reflux. So he was thrilled that, he didn't have to take medication anymore. And the last thing I just want to say is, when I was I mentioned earlier, I worked in Greencastle for 6 years, and there was a osteopathic physician that practiced out